When I was in the insurance industry and I heard things where people would be on the phone with customers and, it would be elderly people. They wouldn't talk to them with the respect they deserve. My dad became sick and he had to be in the hospital, and he went in 2 different hospitals. They couldn't figure out what was wrong in the first hospital. Mm-hmm. Then he had to go in another hospital 2 weeks later, and there was like an aha moment. Oh, we missed something. But there was no responsibility at the first hospital at all. And so it was like, how did we miss that? And they're not going to want to go back and take responsibility for it because it's a financial responsibility. Sure. And then people will talk about suing, and I'm not even interested in that.
Right.
So I will tell you that, coupled with when I was in the insurance industry and I heard things where people would be on the phone with customers and, it would be elderly people, and they would talk to them like, I don't want to say like dogs. That's a horrible thing to say, but like, they wouldn't talk to them with the respect they deserve. And it made me think of like my grandfather, who got the key to the city at one point in time. He owned his own business with 5 stores, was very successful. And I just felt like, like he would be like an invisible customer, an invisible patient to these people. And so what does that look like, to somebody else going through all these things? Like, that's my family that dealt with that. But there are people calling every day with issues like this. So I thought about, how can I take this information and like bring it back, not just from like surveys, because I filled out a lot of surveys, and about what all those surveys are, and they just end up on people's desk. Nothing happens with those surveys. They look good and they get printed, but nothing really happens at the end of the day. So bringing the real stories and the real information and actually sharing that information and making it applicable to how we change the face of the business. So I'm on a real mission to just like change health insurance, change healthcare, the culture behind it. I know there's a few other people in this space that are trying to do that now, but I'm very passionate about that.